Monday night, and that means it's time for Health Watch Oklahoma. We're glad you're with us. As usual, it's 7 p.m. We start talking about the things that you're talking about that you want to learn about, and we're going to just walk through here and bring these guys to the forefront. The Fab 4 is Fab 3 tonight because Dr. Armitage is not with us. And let me just go around and introduce everybody. Dr. Dwight Sublett, MD, Dr. David Chansholm, MD, Dr. Larry Bookman, MD, and me. And we'll start right off with what has been going on since the start of the day, which is when the big media and networks and newspapers started saying, number one, that General Powell had passed away. Number two, within 3 inches of that story became the word fully vaccinated. And I knew at that point that all HE double hockey sticks was going to break loose, and it has. It has turned into, what shall we say, one of those situations where that the misinformation and the outright just confusion has reigned this afternoon. I noticed some of the early tweets. I retweeted one from a network known for not being careful about this sort of thing. Some of those tweets were taken down. But context and perspective about an American hero. Tonight we're having to push back on the misinformation. We should be celebrating Colin Powell's life. Instead, yes, we're having to deal with this nonsense, but that's what we're going to do. And the other thing in my tweet from earlier today is that the recommendation panel at FDA said yes to the Moderna number 2. We'll talk some about that. But Dr. Bookman, just take us through it. It's sad to have to start out on this, but the misinformation, the confusion, and any other words that I could use that are nice has happened. And so it is what it is as we're trying to get over the hump, get out of the pandemic. We have this to deal with.
I agree. It's sad. We just lost one of our true American heroes for many reasons, not the least of which was he was a true gentleman. And whatever your politics are, he was a man who didn't take political sides, but tried to speak the truth and do what he felt was best in each circumstance, whether you agreed or not. That's all we can ask of any of our leaders, is to do what they think is best and be honest about it. And he was. I found it sad. I was working today and really didn't have a chance to watch the news or read much till just shortly before this program. But I was saddened when I saw at least 2 of the, I guess, tweets, although one of them I think was on the air, a national correspondent, I'll call him, more of a show figure, who is using this as an opportunity to put down COVID vaccines at a time when we need to be building this country up. And I'm proud to say I saw tonight that Oklahoma County is now over 80% first shots. I applaud them. I think that's terrific, ahead of the national average. I wish the rest of the state could say the same. But to say that General Powell death was due to COVID and was shows that the vaccines aren't worth getting, I think is such an overreach. We had a big conversation among the 4 of us. Unfortunately, Dr. Armitage can't be here, who may have had the best quotes, as he often does.
I thought you were going to let me take credit for him. Darn it. All right. Well, thanks,
well,
Larry.
I'm going to let you take credit. But,
I was going to use him. I wasn't going to give him any. No.
But, you know, I think that let's be honest, to know General Powell's condition, none of us do. None of us were his doctors. We do know that he had underlying disease, including a blood cancer called multiple myeloma, Parkinson's, and he was 84 years old and he was receiving chemotherapy. So all of those combined make it difficult to say the vaccine doesn't work. See, he died. So, and Dwight, you brought up an article that you read. So let's start with that first, because that's that's the science.
Well,
That's the facts. And let's talk facts and not,
Yeah.
talk about a man's life or death who deserves to be applauded. So,
Yeah. I did a little looking, after this came up, and I did find something from the NIH, and it's like John says, a lot of the stuff we have right now, we're so early into the research and looking at this, but there was groups, independent groups out of the United States, UK, and also France that have been looking at patients with various blood cancers, including multiple myeloma, and the effect, their response to the vaccine. And what they're looking at is the antibody levels, which, as we have discussed before, there's a lot of questions, I guess would be the way to put it, as to where your antibody level and your actual level of immunity is and everything. But the bottom line is that in the study, a significant percentage, in the case of the U.S. study, about 46%, and it was a small sample, it was about 67 patients, 31 out of the 67 patients had a very blunted response to the vaccine regimen. And this material was gotten primarily after vaccines were started. But that was one thing that I found, and I can't say that I'm surprised by that. Particularly if you're immunocompromised, obviously you're probably going to have a blunted response to that. Now, what does that mean? First of all, we still need more patients to look at. Secondly, what does the antibody level, what does that tell us? I think we're still working on that. So, and as you mentioned, age is thrown in there, and so I think there's so many factors. I don't think it has, my feeling is it makes no difference. It doesn't change anything at all as far as our ongoing recommendations around this vaccine. It probably emphasizes even further the need to vaccinate. And also, further, we need to pay attention, particularly when we're around elderly individuals or people that are compromised. We need to be wearing the mask still, because we could be spreading disease and not even know it about it. And they're more, it looks like that they're more vulnerable to infection. So I think if anything, it highlights the need that we need to forge ahead and keep getting that vaccine, get as many people vaccinated as we can.
David?
I was going to say, there's the article on the front page of the paper today in the Daily Oklahoman was about ongoing vaccine studies going on at the Lynn Institute and OMR. I think it was OMRF. Pretty sure it was OMRF that is doing the study on how the best vaccine strategies for immunocompromised patients. OMRF has always had a really strong rheumatologic disease arm, and those patients are on a lot of medicines that suppress the immune system because rheumatology diseases are primarily immune based, and so those medicines can significantly suppress the immune system, and so they're trying to recruit for exactly this reason. We saw it in the transplant population very early on. Only about 30 to 40% of people responded to the primary 2-dose regimen, and that was where the whole booster conversation got started, was in that immunosuppressed population. Well, once we saw the data there and we started talking, remember the very first booster EUA was put out there for people who were transplant or had similar immunocompromising conditions. Well, I got news for you. That's chemotherapy. I don't know General Powell's medical history at all. I know he had multiple myeloma, which is a disease of antibodies specifically, of abnormal production of antibodies. And the way you do that is by suppressing the immune system. So I've taken care of thousands of cancer patients in the hospital, had it in my own family like most people. I can tell you, people with cancer don't necessarily die from the cancer. Rather, they die from complications because the cancer has weakened their body to a point, either the treatments or the disease itself has weakened their body to the point that they have another complication come up, either a stroke or a kidney failure or pneumonia or some other what we call opportunistic infections. These are infections that come on, or routine infections that are much more serious in people that have suppressed immune system, and they see the opportunity there because of the suppressed immune system to profligate. But the bottom line is I couldn't agree more with Larry's first comments. General Powell was an amazing man, This is the kind of man that we would need to make sure our kids know about. Born in Harlem, brought himself up, Vietnam War vet, first African-American chairman of the Joint Chiefs of Staff, if I'm not mistaken. You know, had people may not remember, a lot of traction behind that man running for president. And I think he would have you know, done very, very well, performed very, very well. He was polished. He was level-headed, and you know, appreciate the leadership that he showed, which is leadership we could use more of nowadays. That's what I'll remember about Colin Powell.
I absolutely agree, and I will give Dr. Armitage credit. I liked one statement that he made especially, and this is from him, so I'm giving him credit for this quote, that a microphone can be a weapon of mass deception. And I thought that was terrific, because we have too many people with no medical knowledge, with no understanding of his disease processes, or what his medicines may have been, or what other conditions were going on, who are trying to say, look, the vaccines don't work. Let's not go there. Let's celebrate his life, his legacy, and leave this out of COVID. You know, he died from infection. We see that all the time with myeloma patients. You know, my brother died from myeloma.
It's usually what ends up getting the myeloma patients. Remember, we all learned in med school, pneumococcal pneumonia and renal failure. You're supposed to look for myeloma. You remember? I mean, you know, so yeah, he, it's you know, but and to Dwight's point, it makes it, you know, we still have to be cognizant, which is why it's so important that everybody else gets vaccinated. I think one of the tweets that we were circulating earlier, one of the comments on it said, it wasn't his vaccination that killed him, it was your lack of vaccination.
Good point.
Well, until we get everybody vaccinated, there's going to be circulating virus, and those who are most susceptible to it are still going to be.
This highlights very clearly what we talked about last week, guys. The fact that when we have a situation like this, what happens? Knee-jerk response. We just, you know, well, it's got to be the vaccine, you know, and that's just, it's hard to, I agree with what John's saying there.
Weapon of mass absolutely deception. Couldn't be more true.
Yeah.
So, David, we had a lot of FDA meetings this last 10 days. You want to talk about the boosters and what, at least what the advisory to the FDA and what's going to go to the CDC advisory? That people need to understand. This was an advisory. The FDA came out today. It's going to go to CDC advisory, and then hopefully Dr. Walensky will sign off on it. But talk about the vaccines.
Yeah, no, there was a lot of activity. I guess it was the end of last week. Yeah, the Johnson & Johnson boosting, and then you know what we're going to do with Pfizer, or you know, the one that I think a lot of us are watching more than anything is the mixing and matching, because that's happened a fair amount. There are a lot of people that got the Johnson & Johnson vaccine early on that were like, well, after, you know, they got it, and then there was some data about it not being quite as good against Delta and other things, and they saw everybody else getting boosters. And I've seen a number of patients who told me, yeah, I got the Johnson & Johnson, and then I went and got the Pfizer series. So, I mean, the question is, you know, what does that mean? Some of those transplant studies that we were talking about early on did show mixing and matching of Pfizer primary series, Moderna secondary, and vice versa. And what does that mean? You know, there was actually a trend towards people having a little bit more robust immune response in some of those cohorts if they did mix and match. So that is something that's coming out that I think, you know, we'll see where the CDC lands on all of this stuff. I'm not going to try and predict anymore where anything's going to go. But, you know, I think that you're going to continue to see those lanes widen a little bit for people who are eligible for boosters, and you're going to see the strategies be a little bit different too. Do I think there's some merit in mixing and matching? Yeah, I do. I mean, especially, that we've seen people that have the Moderna shot probably have better protection against some of these things, or at least let's just say longer standing immunity, longer standing antibody levels. Let's say that. We don't know about the rest of it yet. And I think that data is going to continue to come in. Now you have a framework where you can get more of that data, because before the booster shots had been pretty clear, stay in class, stay in the same brand that you got before. Another thing that I was reading quite a bit about today, and I know this is a little bit different than what the FDA was talking about, but is trying to see whether or not messenger RNAs that are tweaked a little bit, for the Delta variant or something like that, can be rapidly ramped up, and whether or not they would perform any better than what we have now. Those are things that we don't know. So I think the vaccine landscape will continue to change, but this is really exciting. I'm boosters have been going on for a little while now. Anybody who wants a booster could probably find a way to get one, irrespective of what the new guidelines are. I am really way more interested in next week's conversations around the 5 to 11-year-olds, because once you start getting that cohort on board, I think that we can really make a much bigger dent in this quicker. But again, 80% in Oklahoma, man, is that awesome? Is that in Oklahoma County? Is that just fantastic? Yeah,
that's great.
Sorry. In Oklahoma County, that is just fantastic news, and a real shout out to OCCHD and to Mayor Holt, who have continued to follow the science, follow the wisdom of the medical community in saying, hey, vaccination is the right thing to do. And have not only said that, but have really championed it and aggressively, proactively messaged that you need to go out and get your vaccine, not just kind of stood on the sidelines. I think that's fantastic.
Dwight, before we get to the 5 to 11-year-olds, I just want to say that let's, so that everybody's clear. Number one, the recommendations have not come out yet. This is a recommendation from an advisory committee to the CDC, but the final recommendations have not come out. But it looks like what's going to come out is that all J&J patients who receive the one-dose J&J are going to be recommended to have a second dose or use the messenger RNA, but they're going to require a booster for all of them. Moderna looks like it's going to go the way of Pfizer, greater than 65 and high risk. And Moderna will be a half dose. So there are little differences of each one. J&J is everybody.
Right.
Moderna's half dose for over 65 and high risk. And Pfizer, which has been approved, was over 65 and high risk, but a full dose. So each one's a little different. Patients need to know when they go in, what it is they're getting and maybe what it is they want, because I think there's going to be options now. You're going to, where before we were going all over the state to hopefully get a shot. Now people are going to be able to say, well, I'd like to get the Moderna, so I'll go here. Because I do agree with David. I think they're going to say mixing and matching is okay. I honestly believe that. We've already seen data that using either Pfizer or Moderna for those J&J patients seems to be very good. Whether it's better or not, I'm not going to get into it. Doesn't matter. But it's very good. So I do think you're going to be able to mix and match. What do you think about the 5 to 11-year-olds? I hear lots of parents, even among our friends on both sides, saying, I don't want to give it to my kid this early. I don't know if it's going to be safe. The numbers were not very large. So what are you going to tell all the parents?
It's kind of like what we talked about last week, Larry. I think that we could look at what we've seen in the adult population, particularly the adolescent. We got not as great a number of adolescents that have gotten vaccinated so far, and we're limited so far to the Pfizer vaccine. We don't have Moderna. Moderna is applying for the adolescents, I think. We haven't gotten there yet. And when we will get there with the 5 to 11 year group, I don't know. Hopefully soon. I I think that the safety to me looks good. It's always a situation where, okay, could the child react differently? Possibly, but I think the odds are that probably will not be the case. It would be nice to have a bigger sample size, you bet, and have more experience with it, and that sort of thing. But I just think that it makes sense to go ahead, based on what we've seen so far in all the prior age groups, to forge ahead, but obviously monitor day by day. And we've had situations where we've had to make changes on the fly through this disease and others. I remember with rotavirus, we had to do that at one time. We had to make a change in the vaccine, but it comes down to what's the safest thing for my child. Protection, I think protection is the safest thing. Being proactive, but that's the way I've always looked at it. I think most pediatricians look at it that way, and I think the kids will do just fine with it. I don't. There's nothing. It's not written in stone, but my thought is, forge ahead. We need to get
How important do you think it is that they distribute the vaccine to the pediatricians, so that the pediatrician's talking to their patient versus going to a county health or some big vaccine clinic?
I think that's very important. I think even more, it's important for any patient. It's optimal if they can sit down with their doctor, their provider, and go over the pros and cons, discuss it, and have that person following them up, that sort of thing. But I think probably with children, that even goes up higher in importance. Parents need reassurance. They need to be able to call back and say, "Hey, doc, this is what I'm seeing," and we're going to say, "Well, get them in, bring them by, let's take a look." And it makes all the difference in the world. If you've got a trusted provider and you can get it from them, that's the way to go. Period. Case closed. Yeah.
David, do you have anything to add to that?
No, I mean, I think that, when we look at, I think it's interesting, and I don't have hard numbers to put at this, but when you look at adult rates of vaccination and who was willing to get the vaccine as soon as it came out, I'm going to say it was around 40 or 50%, I think, right at the beginning, of who was just, clamoring for the vaccine. And when you look at the pediatrics, the pediatric data, it's about, I've seen studies, Dwight, about 20% of parents say they're going to get their kid the vaccine.
Yeah.
I mean, already there you have a huge discrepancy of who's willing to do something for themselves. And granted, we know that adults do worse with COVID, and that probably factors into it and all that kind of stuff. But you're going to have a lot more runway for patients that need to hear more. And I cannot express how much having the vaccine in my clinic ready to inject somebody right after I've had that conversation with them has made a difference in some of my vaccine hesitant folks and some of my vaccine complacent folks. I'm seeing them for something else entirely, but we're having that conversation right then and there. Then I think for any doctor to say, I am so glad we had this conversation. Now, here's the website. Go make an appointment. Take another day off work to go get your kid a shot. You got to watch it for a half an hour.
Yeah.
I think having that tool at the physician-patient interface is so important to trying to get those numbers up. And it's not because you're bamboozling them or anything like that. It's like, hey, man, these parents are already taking a day off work to come to the pediatrician visit. They need to have that tool right then and there available for them so that they can get what's best for the kids. The other thing I would add to that, though, is you're right. Most kids aren't going to get terribly sick, but we have just seen way too much of the kid was okay, the immunocompromised grandma or granddad. We got Thanksgiving coming up. We've got Christmas coming up. There's going to be lots of family meals. I know I have got a pretty long invite list, and I'm going to have to fry a lot of turkey this year. So that's coming up, and we want everybody to be safe and happy. And the last thing we want is what we had last year, where some of those events became a super spreader, and And even though everybody at the table might be vaccinated, let's remember that you still, there are going to be some people at that table who are going to be a little bit weakened, and you want as much protection as you can get.
And their kids in the schools, it's and all the contact spots that the kids have, that are they're cancer patients or whatever, they're on chemo or that sort of thing. So they're going to be in contact with vulnerable individuals. But I just think protection's always the way to go. I mean, we've always been pro-vaccine. I know the Academy has no reservations about it.
I haven't heard any concerns from any pediatrics groups. Have you?
In fact,
they're all
they've
pushing
been.
You compare this to the OBGYNs. Bless them, have come very much on board with vaccines now. But they at first they said it may be an option, and then after about 3 months of kind of some of the misinformation, they really came out and said, no, you need to do this. As far as I know, the AAP has really been, particularly since you have the adolescent data, has really been behind it very, very strongly. And
believe me, I've been with the Academy for years. If there was something they were concerned about, it would be out. It would be out. Not only to us, the doctors, but to the public in general.
And let's remember, most of the national vaccine experts are trained pediatricians. Most of them are not necessarily adult infectious diseases doctors, because that's not where the vaccines are given.
Yeah.
Most vaccinologists are trained pediatricians.
Paul Offit, great example. Philadelphia. Yeah.
RJ Whitley. The people that are on that FDA advisory committee, most of them treat kids.
Yeah.
Well, and I think that this is also an opportunity and I do think pediatricians do better than adult, as I'm an adult internist, as David is. I think pediatricians probably do a better job of establishing a patient-physician rapport. But this is an opportunity, a great opportunity to sit down. Don't spend 5 minutes and say, "Oh, runny nose, don't worry about it. See you next time." No. Sit down, establish your relationship with your patients, talk to them, answer their questions, relieve their anxiety. I don't have any problem with parents being anxious, but the doctors need to talk to them. They need to take the time to really do what's called old-fashioned medicine. Back when I was a kid, doctors actually talked to you in the office. And this is an opportunity.
This is a good
to reestablish that.
Right.
So I hope physicians take that opportunity, and I hope more than 20%.
I think it'll be
get
there.
The vaccine.
I really do. I think once it gets rolling, if we're seeing good results, I fully expect to see good results. I think we'll start out low. Yeah. But I think
you'll start getting the banter in the carpool line, and at the kids' soccer. Oh, you got your kid back there? Well, little Johnny looks
word of mouth. It's going to go. It'll move it around.
I think you'll start to see that. It'll just kind of roll on from there.
Right.
Well, let's talk about what the single word that's become probably the biggest taboo word in the American language in this last 6 months: mandates. Oh my God, Governor Abbott, our dear governor to the south, came out with another executive order today that says nobody in his state will have a mandate, that he believes in personal responsibility, that vaccines should not be mandated. And I think that's great. I'm hearing feedback somewhere. I think that's great that he doesn't want mandates. I think in a perfect utopian world, everybody does the right thing and we don't have mandates because they want to do it because it's what's right. I'm not sure we're seeing a utopian world today. So we've seen that mandates have increased vaccination by up to 30%. What do y'all think about what's happened to our South and maybe happening in this state as well? Because Governor Stitt has followed Governor Abbott many times.
I think when you take away the stick, sometimes some of the behavior changes. Before, it's just funny to me how the talking points changed. Before it was local communities make your own best decisions. Well, And that worked for a while. That's what the beginning of this was. You know, we're not going to, and now all of a sudden it's like, no, we're going to pass all these laws across the board to appease the very loud 2 or 3% and to placate another 10 or 15%. You know, I was so edified when I was at one of my recent healthcare facilities, you know, where I talked to a lot of different folks there who are pretty vaccine hesitant about it. And some who are quite vocal about it. And then we have a booster clinic and there are hundreds of people there. And I'm just like, you know, we forget that the vast majority of people are probably for the vaccine, at least in Oklahoma County. I live in Oklahoma County. I do not live, you know, in Lowe County or somewhere like that. Right. And I don't mean to point out any specific county, but here in Oklahoma County, 80% of people apparently are pro-vaccine at least. So we forget sometimes that the vast majority of people are pro-vaccine. The loudest minority of people are anti-vaccine. And this idea of mandates, to me, is I don't think anybody wants a mandate. We'd rather just everybody lined up and took the sugar cube, right? Like we used to do. But I understand, you know, where that comes from. To me, though, if I run a business, if I'm a small business owner, and I am a small business owner, you know, do I not have that right in my workplace to mandate, you know, these sorts of things for my employees because my insurance rates are going to go up if, you know, someone's sick? Look at all the self-insured plans now. You know, they're starting to charge more to people who aren't vaccinated. So they're going to find different ways to get the stick out there. I think it's only a matter of time until insurance companies start raising their rates. You know, they do it for smokers. We do it all the time. You know, unsafe drivers have higher insurance rates. I mean, so I think, you know, it's just words. It's just silly, and it's just more sadness to me about the death of respect for science.
Yeah, it's so sad that the politics and the public health has gotten intermingled here. We just need to look at we need to look at the science. We need to, and historically, I don't remember. Correct me if I'm wrong, where we've run it. I know when polio came out, I'm old enough to remember. Oh my goodness, we were glad to have a vaccine. When we had vaccines for measles and all that stuff. Oh my goodness. And when we got a vaccine for Haemophilus influenza type B, I quit tapping kids back, you know, to check for meningitis. That just went away, you know. We were overjoyed, and none of this, we weren't hearing any of this that we've heard with COVID. Granted, this has come on so rapidly, and we've had to make moves rapidly. But the methodology that's been used has been great. The vaccines look great. The data, and we've got a lot of folks vaccinated now. I just don't. I don't know. I have trouble understanding it, but you know, I think that I think that employers should have the right to say, yeah, if you're going to work here, you need to be protected. So,
well, I agree, and of course, Dwight, you and I are the only ones probably old enough to remember taking the sugar cube when it first came out. But you're right. I mean, we've gotten into a society where everything is, and there's nothing wrong with questioning it and learning about it, but not just being anti whatever it is. Because now what I'm seeing a lot of verbiage, a lot of loud people is, oh, we're against the flu vaccine because it's another vaccine. We shouldn't take that. And we've been giving the flu vaccine for decades. You know, it's not new. So it's not the fact that it's a new technology. It's not the fact that, you know, it's dangerous. It's not the fact that science isn't behind it. These people are just anti because it's establishment. And it goes back to the 60s when everybody was anti-establishment.
Yeah.
But I mean, you say personal responsibility. What about community responsibility?
Exactly.
What about social responsibility and your fellow man? Putting on your seatbelt is personal responsibility. Taking a vaccine to make sure you don't spread disease to others. And yes, I know people with vaccines can spread disease and all that kind of stuff. But your duration of illness is much, much shorter. Your duration of contagiosity is much, much shorter. The likelihood that, you know, I have a responsibility to my kids to try and provide for them. I mean, what about all of this stuff? There's more than just personal responsibility. because he has to qualify it as personal. Because if you just said responsibility, well, then there's a lot of responsibility that people have to make sure that this community is as healthy as it can possibly be to everybody else. By taking the vaccine, you're doing that. If you choose to eat a bunch of cheeseburgers and run the risk of a heart attack, that is personal responsibility. Right. Because I'm not going to give you a heart attack just because I really, really, really like pizza. It's not the same thing at all.
No.
And it's no different than any other infectious disease when, we've told parents with children who are sick, running fevers, stay home. It's no different. I mean, why do you stay home? It's not because you're going to get better any faster. It's so that you don't spread it to the rest of the class. That's social responsibility.
Exactly.
Scott, you got some information, I understand.
So I don't think I got to tell this last week, but by the way, tonight, it's the second week we have an audience at YouTube, on YouTube Live. Hello, YouTube. We're glad to be here. Hope you're enjoying this. So as I was looking at News 9's YouTube, there happened to be a story from 1979. And there were two stories I wanted to tell you about, which is, I think people will enjoy this. Number one was there was a rookie reporter there at News 9 by the name of Mike Betcher, who, as you know, is a Hall of Famer and is one of the greatest reporters that ever lived. And he was at News 9. There was a story about daycares in Oklahoma. There had been a statute on the books for some time that people from Oklahoma City County Health Department, and by the way, I should say it is Oklahoma City County Health Department. The mayor gets a lot of props on that, but half of that board is appointed by county commissioners in Oklahoma. Yeah. So it's props to the folks at 80%. But the story was that the Oklahoma City County Health Department was going to start inspecting these homes that were home daycares. And it was funny because Mike was quoting some of the folks that had these that hadn't been inspected before, and they were saying, you're going to look in the closets where these kids are, you're taking away my freedom. And so I was getting a real chuckle about that one. Number two, CBS had a rookie reporter that they did a story in Pennsylvania, in Amish country. And the rookie reporter's name, I think, was Sawyer, maybe first name Diane. Okay. Yeah. So the story was that there had been this 1979, Jimmy Carter is president, there had been a polio outbreak in Amish country in Pennsylvania.
Remember that.
And so some in the Amish community had been pushing back. There was a doctor who was on there who said basically, look, we explained to these people what was going on then, and they were giving them the eyedropper full of the sugar cube type thing, right? Mm-hmm. And he said, once we corrected the misinformation and we explained to them that this was to help their fellow people in their community and outside the community, there was no more discussion. How times have changed, huh?
A little bit.
Oh boy.
Oh boy.
Yeah.
You're right.
Yeah. And that's what I was saying. I mean, times have changed and people are to be anti, not because there's information, true information. Mm-hmm. And I don't want to get into social media and all those things. That's a whole different discussion. But we just need people to understand that physicians and the scientists are out there trying to help, trying to get us past this pandemic. The virus isn't going to be gone. We're not trying to kill the virus. And that brings me to my next subject that I want to talk about. I'm going to throw this to David first. And that is this new discussion on the Delta Plus virus. We've talked about Delta for a long time. Now they're talking about a new variant, Delta Plus. Don't know. I'm sure it's in the United States. I mean, whether it's tested or not. But do you have any information that you can share that people might find interesting and need to know about Delta Plus?
Well, I think this happens a lot with all of these variants. We've seen it so you start out with D614G, right? That's the wild type. You go to Alpha. Then we went to Gamma. Gamma was the big P1 variant that came out of Brazil. And then we went to the Delta variant. And then there was fears about the Epsilon variant. There was fears about the Lambda variant that came out of California. Lambda. We were for sure that one was going to be a wildfire, because all wildfires come out of California, right? But anyway, so we were sure that was going to happen. Listen, it all merits monitoring The Delta Plus variant is just something that has acquired some other mutations. There have been a few mutations that have been shown to make the original wild type coronavirus, SARS-CoV-2 virus, that have been shown to make the original SARS-CoV-2 virus more transmissible, more contagious, more pathologic, whatever. And the Delta Plus is just something that is maybe a Delta variant with aftermarket parts, so to speak, that might help it to become a little bit more effective. I think, like all of these things, they have to continue to be monitored, and they have to, because one of them might catch fire and start becoming very, very problematic. But, in the UK, where they've already seen some of the Delta Plus variant, they've seen it there, but it just hasn't gone crazy. Why is that? Probably because there's a fair amount of herd immunity now from vaccination and from natural infection. And it may be because, the time isn't right for it, or it hasn't yet become a perfect storm. Is it possible that something like that could happen? Absolutely. We've seen that now several times. I mean, if you think about it, SARS-CoV-2 in and of itself is kind of a variant, right? I mean, it's a variant of SARS. It's a variant of native wild type coronaviruses.
Right.
I mean, they're all kind of variants. So to say that something couldn't kind of come up, yeah, sure, it could. And that's why, like we talked about earlier with the vaccines, where they're looking at maybe even tweaking the messenger RNA, seeing how rapidly they can do that on a production platform. That's where that kind of science becomes really, really important to see whether or not those tweaks would work. Theoretically, they might. Realistically, they might not. There's lots of things that we think work theoretically that don't work that well when you put them into a rigorous study environment. So continuing to monitor that, and that's kind of where you see those designations that the CDC keeps putting out there: variants of interest, variants of concern, variants of great significance. They kind of keep moving those viruses back and forth among that as circumstances change. We'll have to see. I don't know how much Delta Plus has been seen in the United States, but it's we still got plenty of Delta. I'm gonna worry about that one more than anyone right now.
Well, and I think, at least from the little bit of reading that I've been able to do on Delta Plus, what's really important, I think there's 2 points that you alluded to. One is that it hasn't really spread like wildfire, and probably because of natural immunity and vaccines, that it's keeping it under control. Again, I think people have the misunderstanding that we're going to kill this virus, it's going to be gone, and it's going to be part of our history books. That's not what's happening. The virus is like the flu. It's a virus that's going to be here. It's going to change. But as long as we keep it controlled by getting people vaccinated, and the more people who get vaccinated, the less transmission, the less mutation will occur. So, I think that's number one. But to me, what's most interesting is what you brought up at the end. This is, again, where bench science, basic research science, is meeting clinical medicine. And, I mean, if they can come up with mutation-specific vaccines rapidly, that's really... that's amazing stuff.
Oh, again, we still don't have the first protein subunit vaccine on the market in the United States. Traditional vaccine technology has still not made a presence here. Now, the Novavax studies are ongoing, but all of the vaccines here are of the newer technology. And I'm not kidding. I've said this before. I foresee a day when a lot of vaccines are going to be messenger RNA vaccines, strictly from the technological standpoint and the production side of things. It is so much cheaper and more efficient to make these, and
faster.
Clearly, they are highly effective.
Yeah, and it's quite effective.
It's not an easy book to read, but I will promote a book called The Code Breaker for all those who have not read it and want to learn about this. It's not a book that you have to be a physician to read. It is incredibly fascinating reading to see how quickly this all, from start to getting a vaccine on the market, how quickly these scientists got it out, worked hard, 24 hours a day, and how many different scientists at different research institutions were involved. Great reading if you haven't read it. So it took me a while to read it, but it was. At this point, we've got about 10 minutes left, and I'd like to know, Scott, I don't have the ability to see questions. So are there any questions that we've not been very good about saving time to answer questions the last few weeks?
Most of the questions, we have leftover questions from last week, if I could get to a few of those.
Go ahead.
Here's one on here from Julie. Julie
Yep.
Lovegrove watches every week. Personal responsibility, question mark. How's that working for us? Question mark. Here's a question.
Anyone want to take a stab with that
I
one?
agree.
Yeah.
Yeah.
I think the polling is on that one. That didn't work out so well.
Not so good.
I think we had quite a bit, as we were getting to questions last week, and there was a lot of discussion. It was the mix and match that was a lot. Maybe you could go back to that from what the data is saying right now. I saw it may have been Dr. Armitage's favorite doctor, and you all know Dr. F. And Dr. F was talking this weekend, perhaps saying, maybe we should have made J&J a 2-shot. You may have seen that one. And I should throw up the Faucification slide, but I don't have access to it right now. But so the mix and match, when we ended last week, that's where people had lots and lots of questions.
I'll go back to the J&J thing. You know, when the Pfizer and the Moderna shots originally came out, it was truly one of those things that was too big to fail. And if you had a study done that was only a 1-shot series and it didn't show a significant impact on the disease trajectory, we were going to be a year behind. They had to do a 2-shot series to make sure that they saw something there. If you look at the efficacy of a single shot J&J, it's not much worse than the efficacy of a single shot Pfizer or Moderna was. So I don't disagree with the idea that a J&J booster is a good idea. Is a J&J primary series a good idea? Or should we have just done 1 shot with the Pfizer and the Moderna followed by a 6-month booster? These are all questions that are going to be answered by science over the next 10 years. All of these questions are going to be answered by science. But so, you know, the retrospectoscope is what we call it in medicine. You know, Monday morning quarterback, whatever you want to call it, hindsight's 20/20 about the J&J. It's still a good shot. It's still an effective shot. But a 2-shot series probably will give you more protection. The mixing and matching, there's been some preliminary studies that show a modest increase in antibody levels with mixing and matching of Pfizer and Moderna. So I think when those studies are finalized and are finally out there for public consumption, we'll see. Do I think it's going to be a huge impact? No. I think it has more to do. I think the reason mixing and matching is more important is just for availability. Listen, let me tell you, as a guy who does vaccines, as an office who does vaccines, it's a pain in the butt storing some of these vaccines. It is easier to store. It comes in a multi-dose vial. I hate. If I have 5 patients in my office and 3 of them need Moderna and 2 of them need Pfizer, I'm throwing away a bunch of shots. But if I can just give them all 5 a Pfizer shot, then I'm only throwing away 1 shot. You know, so I mean, it makes a difference. I think it makes a bigger difference logistically probably than it does immunologically, if that makes any sense. And what you're going to see is what we call a non-inferiority trial or non-inferiority standard of efficacy, where the intervention that you're studying has proven to not be worse than the standard of care at that time. So the question is really, is mixing and matching worse than staying in brand? And do people have any more adverse events or not as good of a clinical response? Again, there may be a modest improvement, but I don't think they're going to recommend mixing and matching because it's so much better than just staying with one vaccine. I think it has way more to do with logistics than it does with immunology.
Yeah, I think you're absolutely right on that it has to do with availability, people not having to travel distances, you know, get what's available if it's about the same. But we do know that with J&J, I mean, the numbers, although small, incredibly small numbers that they looked at, but they went from, I think, 74% to 93% just with a second J&J shot. So I don't think there's any question that J&J needs a second shot. I don't care what it's going to be, but they're going to need a second shot. And I think the mixing and matching, we just don't know at this time until the studies actually come out. But I agree with David. I think it has a lot more to do with making ease of accessibility.
I want to underline the point about the offices because, a lot of times we get shots based on, particularly if you work for a hospital group or whatever, based on a bid. And so if it's a situation where it doesn't matter whether you take the Pfizer, Moderna, or Johnson & Johnson, then economically it's going to make a difference. And you like it or not, you got to figure that in the mix here. And so that it'll make it where the offices have more accessibility if we can spread it around.
I'll give you a perfect example. Moderna originally came out in a 10-dose vial, and then it went to a 15-dose vial.
Yeah.
And I was saying, I wish they would quit making it a 15-dose vial. I wish they would put it in a 5-dose vial.
Right.
Because now if I've got a 15-dose vial, and that's the only way they're shipping Moderna, and it's a half dose for boosters, I got to find 30 people that need a booster.
And
that's not easy.
You're going to waste vaccine.
Yeah, and I got to use it all within 6 hours. So I mean, it's potential for a lot of wasted vaccine if we don't do it. So I applaud it. I'm excited about it. I think it's a great idea. And I got news for you. There's some people who accidentally got the other shot. They
already
didn't
mixed it.
Necessarily know because there are people all the time say, well, I can't remember which one I got. I'm pretty sure it's Pfizer. Okay, I'll give you Pfizer.
Yeah.
I know some people that have done it intentionally. I've gone in. I told the pharmacy that I had gotten Moderna, but I had really gotten Pfizer, and so I got
I
One
have
other
a couple
question.
more here.
Yeah.
And I want to do a shout out and a question at the start as I'm watching the little ellipse going across here as I get this last screen. So this is it's on Twitter. There has been an individual in Oklahoma on Twitter named COVID-19 in Oklahoma. I don't know him. We haven't met. Hope to at some particular point. On Twitter, COVID-19 in Oklahoma, who has been, since the beginning of the pandemic, the single best repository of information on a daily basis since this began. I mean, this is like going to Snopes about misinformation or whatever. This guy has been killing it. COVID-19 in Oklahoma has been watching us, and occasionally I'll get notes from him and he'll say, it's a good job, or I need to know more about this. And so a hat tip to COVID-19 in Oklahoma on Twitter. If you're not following him and you're interested in this, I will tell you will get zero nonsense at on his account. I mean, and he is good. I mean, he's got as much data as Anthony Fauci and even more, and does a better job of communicating it. And he has asked this question. There might be a trick. How many people in Oklahoma have been hospitalized from the COVID vaccine?
I don't know the answer.
I don't know how you get that answer.
Knock on wood, I haven't seen anybody with it. I've read some concerning reports around the country, but I don't know.
No.
You'll hear anecdotal reports of people saying, "Oh, I had a friend or a cousin."
Yeah.
But the numbers are going to be in the handfuls. They're not going to be large numbers, and I haven't seen an actual study or report to actually report a specific number.
We'll probably see that eventually on the VAERS data. But, to me, hospitalization means care requiring an inpatient stay for greater than 24 hours. I can promise you a lot of people went to the hospital with 102-degree fever after they got the second shot.
Right.
Probably checked in the ER for a second. Some of those people were diagnosed with COVID, by the way. I did it a few times, so I know. Mm-hmm. But hospitalization. I'm not going to sit here and pretend like there haven't been some reports of people with very, very serious side effects, but it is nowhere near the number of people who are unvaccinated who have very, very serious side effects from COVID. So, to me, it's a great question. If you believe the numbers. If we're at, how many doses are we at total now in Oklahoma? About 3.5 million.
I think that's right.
Just over 2 million fully vaccinated, something like
Yeah.
that.
Over 2 million.
Figure about 3.5-4 million doses. If you believe the numbers, that should translate to an adverse effect of maybe 20 to 30 people. but I personally have not seen any.
Well, what he's saying is there are people out there saying, oh, we've got all these hospitalizations due to the vaccine, which is, and I think COVID-19 in Oklahoma knows what he's saying is you're getting all kinds of people making claims, like network people today claiming that the vaccine killed Colin Powell. I've seen some of those. It went from didn't protect him to killed him, just on Twitter in an evening. And so I do appreciate his work. And by the way, there are two letters that he uses. If you don't know
who it is, it could be a her.
It's probably a he, but we're being very careful. I believe it is. COVID-19 in Oklahoma is he's good if he's a he, and he's listening right now. It's the time of year we could do a seance here. COVID-19 in Oklahoma. Are you a he?
Are you a he pronoun?
Yes. What is the right pronoun? Because I'll tell you, his information is solid. It is as good as it gets. I have a sneaking suspicion I can narrow it down to a town and perhaps even responsible media, but it's only a hunch. What I do know is that I vouch for what he's saying because it has been solid since the very beginning of this.
Well, and I think we need to give a shout out to all those people who are vocal, who have been on television, who have given accurate, factual information and supporting the vaccine. There's a lot. I think David said it best. It's a vocal minority who's against it. Certainly in Oklahoma County, the fact that 80% have gotten at least one shot shows the people are for it. And there's a lot of people speaking out. So I thank COVID-19, but I thank all the people. And everybody needs to speak out. We can't let a vocal minority run the roost. I guess it's rule the roost.
I've got a question. Let me throw up on the screen here, if I could, doctors.
Yeah, I was looking at that myself. That's a good question, Kim. David, what's your thoughts?
Well, I mean, 75 pounds, that's only 35 kilos probably.
Yeah. It's a good question.
So if you took the first dose, I guess my first question would be, did you take the second dose, since you're asking about a booster? But it's hard to know. It's hard to know whether or not those kinds of things would happen. If you had the second dose and you didn't have a serious reaction, that's fantastic. And you also need to ask yourself, are you in one of those categories that is recommended strongly to get a booster shot? Because again, not everybody is. You look fairly young in that photo, Kimberly. And if you're under the age of 50, you're going to have different risk factors that would merit boosting than others. So
she has not got the
shot. Okay. Right. Okay. Yeah, no, I think that's definitely a conversation you should have with your physician.
Yes.
But it something you need to take into account. The good news is, even though you had a reaction to the first vaccine, you probably still got some pretty good immunity from it. So there's that.
And I would add that if you're going to get the half dose second shot, do it at a medical facility that's equipped with Benadryl, steroids, and spend 30 minutes or even an hour there afterwards, because those are treatable side effects, treatable symptoms. Don't go home where you can get yourself into trouble.
No, it needs to be monitored.
Let me throw one more up here. You guys will love this one.
I got a different take on that, Miss Whittingham. I think that the federal government themselves actually bear a fair amount of responsibility for the addiction crisis when they told us pain was the fifth vital sign. Medicare's gotten a free pass, in my opinion. What company was the Sacklers? I guess. I don't know. I don't think they're making any vaccines, though.
No,
so no correlation. No correlation at all.
No. And that was Congress and the FDA and a whole lot of people who take responsibility there. And David's right. We were told as physicians that pain was the fifth vital sign, and that, physicians shook their head when we were told that to start with.
Mm-hmm.
But, yeah, we were given a lot of bad information.
That's a whole different tree to
Yeah.
be dealing with tonight. I guess the last one that I'm seeing some messages, private messages, flu season coming. Last season, the flu season was really low. I saw a couple of stories this week. I think Dr. Chansel said last weekend you were talking about if I need to, I'll line them up and get into one arm and then the other. But people are, when they're coming in and they're asking about the flu and they haven't had the COVID shot, for example, what are you telling them?
We talked
Get
about
both.
that last week, and we said you can take them
Get
both
both.
at the same time.
Yeah. Both at the same time.
Like
Again,
bar,
at the very beginning, so a couple things. The very beginning, when they first had the COVIDs on the first EUA, it was recommended do not have another vaccine within 14 days.
Right.
And that's something that we've done before. For example, you're not supposed to get 2 live virus vaccines within a
Right.
month of each other. So
Usually spaced
you
at
don't
about
give
3 or 4
MMR
weeks
and
apart.
yellow fever together, for example.
Yeah.
But that's changed, and it changed primarily during the summer when the EUA came out for adolescents to get the COVID shot. It really tightened the timeline for children being able to get all their vaccines that they needed for school if they had these 2-week windows on either side of when they were getting the vaccine. And so as we did more and more studying on it and everything like that, it was pretty clear anecdotally and from more science, again, this is all science, it was pretty clear that it was okay to give both of those vaccines together, to give several vaccines together. And, you had kids getting tetanus
Right.
shots,
We
to
do
get
that all the time.
schedule at the same time as they were getting
Yeah.
COVID vaccines and things like that. And so that's why that changed. So the short answer is, when we were giving out flu shots in the physician's lounge the other day, they were getting COVID boosters at the same time.
Yeah.
We've been doing it in the office.
And influenza is so bad to be, it'll just hit,
Mm-hmm.
like gangbusters. All of a sudden, you get caught off guard. You get the flu shot. Yeah, definitely.
I got, and I'm wanting to know if I could answer a doctor question. Would you guys let me take a shot at this one? Okay, Estella's back. There are no long-term effects from the vaccine. Here's what I'll tell you. Estella, I'll let you know. I'm in the Moderna trial. But I listen to these guys each week. I can explain to you the long-term effects from COVID, and I'm not a doctor. How did I handle that, doctors?
Took you a little while. I'll tell you what the long term, a long term effect of vaccination is immunity. That's the long term effect you get from it. No, there's no aborted fetus used in the vaccine. Stop it, Estelle. Come on, you're trolling now. You just stop it.
Yeah, I'm guessing she doesn't have the vaccine.
Yeah, I'm guessing she's not won the vaccine.
Yeah. Well, pretty good show today. I will tell you, I did post Dr. Armitage's statement, mass deception, not mass distraction, mass deception, he said. So we'll be without him for a couple of weeks. He's off enjoying life because he's vaccinated. So having a good time, as what we did a couple of weeks ago in Maine, where you had to have proof of vaccination to get in there. But it felt like freedom to us because we had our vaccine. It's an interesting take on that, wouldn't you say? So next week, I will tell you, we've mentioned them several times, but Dr. Patrick McGuff will be here next week.
Oh, great.
Because the FDA, I suppose, doctors, the FDA is going to be taking up, since the advisory committee gave the green light, will they be meeting this week to green light the Moderna booster? Will that happen this
They're to
week?
meet
I
this.
haven't heard
this
the
week.
announcement yet. It's odd because you're right, Scott. Usually we've heard when they're gonna make their.
The final is October 26th.
Okay, is that what it is? I was thinking. For
Yeah.
some reason I had that in my head as the
So that would be
the kid stuff.
Week from
No,
tomorrow?
well, that's yeah, huh?
So a
Great.
week from tomorrow?
yeah.
That's
So,
when the
Patrick's
final.
still going to
I'm
be
not
here.
sure the kids stuff's going to get done before
November
I don't think it's
it's
going to
supposed
get
to
done before Halloween. I think it's going maybe in November. I'm hoping.
Yeah, first week in November, they're saying.
Yeah.
Well, thank you all for tuning in. It's really great to be on YouTube, for those on Twitter, also on Facebook Live. LinkedIn, get your act together and approve us, and we'll be doing it on LinkedIn, but they haven't, and I'm not really sure when the government took over LinkedIn. But anyway, that's the way it goes. Thanks so much to everybody, Dr. Sublett, Dr. Chansone, Dr. Bookman, to our friends at News 9 News on 6, Ryan Welton. And if you're not following COVID-19 in Oklahoma, well, you're backing up, as the old country song would be. And we appreciate everybody doing what they do each week. And for you watching us each week, we'll be here next Monday at 7 p.m. if the creek don't rise too high. And it's a great moon, by the way, out the window tonight. So great weather. And can you see it, Dr. Chansone?
No, I'm
It's a
looking
good
to the
one.
north. I'll go outside in a second.
It's a good one.
Hey,
All right.
can I throw one more thing out
Yes,
there?
sir.
Scott, I know you're trying to. Last week, I was just watching TV randomly, and there was a documentary out there from SSM Health, which is out of St. Louis, but they did an hour-long documentary called Behind the Mask. It was very, very good. Actually brought some tears to my eyes, and a lot of it was done at St. Anthony's here in Oklahoma City, who I can assure you has taken on quite a bit of COVID in downtown Oklahoma City. About a third of it was done at St. Anthony's, which is a member of SSM Health. A lot of it was from Wisconsin. A lot of it was from, I think, St. Louis, and one of their other. But it was very, very good. Featured some of our local physicians here, and one absolutely heartbreaking story from a local patient. Mad love to SSM Health for I mean, Bob Costas narrated it. I mean, that mad, crazy production value. And it was very, very good. And I know it's out there. So if you get an opportunity to look at it, it really puts a human face on a lot of this stuff.
All right, we find it. We will, if you can find it, Dr. Chansone, or I'll look for it.
Yep.
And then we'll pass it on Twitter on our Facebook page. In the meantime, have a great evening, everyone. We're trying to figure out exactly what the Dodgers are thinking. Okay, they were ahead doing
Go Braves.
Yeah, well, they're in the driver's seat here.
I love it. I'm a Braves
Okay.
fan.
By the way, if you have Bedlam tickets, you're really doing good. They're going to be up 400% over last year. So,
Wow.
yeah,
So-
that's what's headed this
Boomer
way.
Sooner is what I say.
Boomer Sooner.
All right. Good night, everyone.
Good
Good
night.
night.
Good night.